Good day. Welcome to another episode of In the Dugout. And this episode will be unlike any other. It contains allegations from a government whistleblower that are so disturbing and so explosive that the mainstream media in our state refuses to cover it. The issue at hand is whether the Rhode Island Department of Health grossly failed in its oversight responsibilities over our state's nursing homes and other congregate care centers. Has it been massively incompetent in managing and investigating thousands of complaints? Did officials engage in cover-up actions? And did this pattern of ineptitude lead to a multitude of unnecessary deaths during this coronavirus pandemic? You likely have heard that the COVID-19 virus has hit especially hard in senior care and nursing homes, with about 40% of related deaths nationally emerging from these facilities. But did you know that Rhode Island's rate of deaths from nursing homes is double the national average, with some reports putting it near 80% of our state's total facilities? Why? It has gotten to the point where recently members of the General Assembly are calling for the immediate convening of the House Oversight Committee, even while the General Assembly is in absentee mode, so that that committee can conduct an investigation into what's going on at our state's congregate care facilities, nursing homes, assisted living facilities, and the Rhode Island Veterans home. And now, because of the stunning evidence you are about to see by a whistleblower from the Rhode Island Department of Health, we might know why this horrid situation exists in Rhode Island among our senior citizens. According to the whistleblower, who you'll meet in just a few moments, a long pattern of neglect and incompetence at our state's Department of Health created what she calls a perfect storm for the China virus to run rampant through our senior care facilities. And when her efforts to raise alarm bells about these serious problems started to become a potential major embarrassment for the Department of Health, as well as for elected officials at the highest levels of our government, our state government, she suffered workplace recrimination and was demoted, ultimately leading to a whistleblower lawsuit that is still dragging on many years later. Her allegations are so alarming, so explosive, so disturbing, and even though no other media entity or politician in the state she contacted would touch it, and even though our center is not an investigative journalism entity with experience verifying and tracking down leads, I felt the evidence and our guest are credible enough that we are compelled to provide her with a forum to tell her story. The purpose of the story is to get the story into the public, of this interview, I should say, is to get this story into the public domain, where it'll be up to others who should have been doing their jobs in the first place to vet and investigate Lisa, who you will meet, and the evidence. This interview is not seeking to validate or disprove Lisa's allegations, but rather to clarify what she has evidence of, what she can prove, or what she believes is going on, based on her many years of experience at the Department of Health. With seniors continuing to die daily at nursing homes now, we also don't have the luxury of time to wait for a full investigation of this story before airing it. Further complicating any investigation, the governor has weakened access to public records, blaming delayed access to state documents on the pandemic itself. This means it could be a very, very long wait before the government might choose to release records. I don't believe the public can wait that long to hear these allegations. But before we bring on Lisa Camuso, who thankfully has amassed hundreds of screenshots and audio and video files on her own, let me first review the alarming claims and questions that arise from her evidence. And keep in mind, playing devil's advocate as well, that uninvestigated complaints do not constitute proof. But when hundreds of similar complaints are filed, maybe that pattern does necessitate the need for investigation. If there is someone you love who lives in a senior care facility, or even if you're just a concerned and compassionate citizen in our state, you need to stop what you're doing and listen very closely to this interview. First, the whistleblower claims she can prove that at least since 2016, that the Department of Health in Rhode Island has not investigated or even processed an enormous backlog of complaints by family members and staff about neglect or harmful care of seniors at nursing homes throughout our state. Think of the Department of Health as a police force who, if they are absent and don't crack down on illicit activity and make an example of those who break the rules, then more bad behavior will certainly take place, if not be encouraged. More recently, since the onset of the coronavirus pandemic, the question is, were residents and staff who tested positive for the virus allowed to continue to walk around or work at nursing home facilities? Were COVID-19 positive residents actually allowed to room with non-positive residents? And here, right now, are the two most egregious questions for which a whistleblower does appear to have supporting evidence. Were many COVID-19 infected seniors allowed to die without any treatment, even while their bed sores, dehydration, or malnutrition were also ignored and neglected? Was clear and obvious evidence of such neglect hidden from family members because they were locked down from seeing the conditions of their loved ones for themselves? Is this one reason why many dying seniors were not transported to hospitals, instead left to die alone in their nursing homes for fear that this neglect might be discovered and reported by hospital staff? These are massive and important questions. And as our whistleblower claims, in their oversight capacity over these facilities, were high-ranking officials in government and at the Department of Health aware of these atrocities? And did they just sit back and do nothing? Why would the DOH not investigate such serious claims and allow backlogs to grow into the thousands without taking any corrective or punitive action? These are deadly serious questions that Director Alexander Scott and I think Governor Raimondo must answer. If any of this is true, further investigations must be initiated and those responsible must be held accountable for their inhumane actions. If much or all of this is true, it would be the most grotesque failure of government we have ever seen. Where were the media, the General Assembly oversight members, or law enforcement who were alerted to this situation and should have been on this story years ago? Where were they to determine if unethical actions, civil violations, or even criminal activities may have occurred against some of the most vulnerable people in our state? Their inactions are also disgraceful. Who are they trying to protect? Why did they fail in their jobs? Now, let's find out why. Lisa Camuso has worked for many years at the Rhode Island Department of Health as a community liaison in the complaint unit, mainly dealing with issues arising from nursing homes and other congregate care facilities under the purview of the Department of Health. Lisa, welcome to In the Dugout.
Hi, thank you. I appreciate you having me.
Well, we've got some very important ground to cover, but as we've discussed, you know, we have a tradition where, because we're in the dugout, we wear our baseball caps. Today I've got my Team America cap because I think what we're about to hear from you is so un-American that this one is appropriate. Lisa, who's your team? What cap do you have today?
Well, I have three. In tribute to you, I have my Boston Red Sox hat, and my heart really goes to these guys. And I just wanted to show my Providence College hat where me and my dad went, and today would have been my parents' anniversary. So I believe that this was meant to happen. So thank you.
Well, God bless. But we're going to break tradition and not actually wear our caps during this interview because of the serious nature of what we're going to talk about today. So we just wanted you to show your colors and show your fun. All right. So Lisa, we're going to start by taking a look at a number of slides and then asking you to respond.
Sure.
All right. So the first slide, which we'll see momentarily here, is a text from a complaint very recently filed.
Oh, yeah.
It seems to capture much of what you believe is wrong with the Department of Health's oversight responsibilities. In fact, in 2017, we'll talk about that in a second, you filed a lawsuit under whistleblower protection laws. And by coming on this show, you know, you fear for your job and your safety, but you see at the end where the staff member says it's terribly heartbreaking. And as we give everyone a chance to read this, Is this why you're coming on our show and speaking out right now? Because you just feel this is too heartbreaking to remain unspoken?
Yeah, absolutely. It's been heartbreaking for years watching what was going on, and very frustrating, very frustrating.
And you've been right in the middle of it in the complaint department. You handle hundreds, if not thousands, of complaints coming in, I assume, on a daily basis. And you've probably more than anyone in this state, you're aware of what's at least allegedly going on in some of our senior care facilities.
Yeah, yeah, very sad.
So on this one, while not all complaints, I'm sure, involve a resident who ends up dying, what I'd like to ask you is this general, the spirit of neglect and incompetence that's captured in this particular complaint, the fear of reprisal. Again, this staff member themselves was thinking about whistleblower protection, and the overall tone of this complaint. Is this reasonably representative? Again, not all end up in somebody dying, but of the types of complaints by the hundreds and thousands that you've fielded over the years?
Yes, yes. It's I feel for these staff members because they're mandated to report these sort of things, but if they do, they will be either retaliated against or fired under other false pretenses. And it's really, 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 my heart goes out to them, because they're doing the right thing. Yeah.
Sure. And it's and it's your claim that complaints like this were routinely ignored by the Department of Health, either by not being investigated thoroughly, or in some cases, I think, as you've told me, not even being entered into the system for processing.
Right. It all created, it was a result of a backlog that was created back in late 2015, and they still don't have a handle on it.
So this lack of a handle, is this something you theorize? Is this something you have evidence of, or is this something you can pretty much prove?
I have a lot of evidence. I can prove this several different ways: video, audio, email. Yeah.
Now, before we move forward, certainly, I think it would be fair to say that the direct day-to-day care of seniors, falls on the staff at the facility. But what should be the proper role of the Department of Health in these circumstances when complaints like this are filed? What's supposed to happen?
Well, they're first of all supposed to be triaged in a timely manner, and that hadn't been happening for a long time. There was an attempt to cover up by putting false triage dates on these incidents and complaints. And so, unfortunately, we have very good investigators at the Department of Health, but they're unable to do their job because the backlog was so big. I don't know the exact number now, but they couldn't do their job because all of the incidents and complaints were either sitting in a room.
Why did they get backed up so much? Where was the break in the system?
Oh, well.
Management? Was it the execution by staff? Was it orders from above? What happened?
All of the above. All of the above. This needs no exaggeration. There was, and what I feel was a setup to fail in retaliation towards me, where it made my job almost impossible to perform, which I performed before. Yeah.
All right, let's go to the next slide. Let's segue into that. So the next slide here is a copy or the beginning of an email. No, let's go to the email, Larry, of what you sent to the Department of Health. A letter you sent, I believe it was to Director Nicole Alexander Scott, way back in 2015.
Mm-hmm.
Where you were frustrated with the fact that these complaints were piling up, and that because you were starting to raise alarm bells, you felt you were recriminated against. So explain this email, Lisa.
Well, this is the second email, as you can see. I sent her my first email on 11/20 after I reported what I knew to her in June. I was asking for her help because the retaliation was creating a backlog of incidents and complaints. And as you can see at the time, in December 2015, there were 200, which I thought was astronomical in comparison to now. It looks quite small to what.
How many now, would you say?
Well, when the last time I had access to the backlog, it was 6,000 almost.
6,000 cases, complaints similar to what we just saw, and like we'll see here in a minute, that were never properly investigated.
Right.
Wow. All right. So this is just evidence of your frustration at the piling number of cases not investigated, the retaliation to you. In fact, you felt as if the backlog was being purposely created so they could blame you for it. Is that correct?
Yeah, of course. And they were just about to launch what's called lean training. Lean meaning, LEAN, exactly what it means to lean down. But they made such a mess of it during that process. I think they truly believed that it would take care of the backlog once they launched the lean program. But instead, it backfired.
Right. And you believe since then the situation has gotten only worse.
Yes, because a lot of really good investigators and people have left out of frustration. We have a lot of new investigators, which, I will state for the record, they're really good people and they really want to do their job, but they can't. So they stay for a little while and then they leave, and you have to retrain these people. So it's creating the perfect storm in the Department of Health, as well as the perfect storm in nursing homes for when this virus hit.
And again, is this worsening situation something that's a theory of yours, some evidence or proof you have?
I have evidence and proof, yeah.
Okay. Let's move to the next few slides. Now, these are now are all since the pandemic has hit.
Oh, yeah.
So here we see a slide talking about unsanitary conditions.
Yeah.
That people, with everybody being careful about touching and distancing and masks and gloves, that unsanitary conditions, water flowing with dirty diapers, potentially infecting them, and fluids flowing from room to room after they try to clean. So again, this could be an isolated incident, or what I'm asking you, based on all the complaints you've seen, is nursing home sanitation a large problem?
Yeah, it is. There's several problems that I've seen, and especially since this lockdown. It's very scary, especially the nursing homes that are meant to be their specialty COVID-19 facilities. It really shocked me, the choice that they made, and it also shocked me from what was coming in and what I was hearing.
And it should be obvious to everybody that these unsanitary kind of conditions would only hasten the spread of a virus if it were there, right?
Of course, yeah, of course.
All right, let's move on to the next example of a complaint. Now this one, again, we'll talk about,
Yeah.
but this one shows that there was actually cocaine
Yeah.
smuggled into the nursing home, and the two men apparently roomed together, overdosed.
Yeah, notice the facility.
What about it, Lisa?
That's their specialty care facility for COVID-19.
What do you mean specialty care facility?
This is the facility that your governor chose to be the specialty care center for COVID-19 patients.
So these two gentlemen with COVID-19 somehow were taking cocaine. Where's the oversight? Where's the staff on something like this?
To be quite honest with you, I'm not sure because I am no longer allowed to know what's going on.
All right.
I'm hoping that they definitely nip this in the bud.
So again, it's not the responsibility, I think you would agree, of the Department of State to stop the actual smuggling of drugs, you know, but isn't it their responsibility to investigate such an outlandish and dangerous claim like this? I mean, are you aware that this incident and this email references a prior drug smuggling incident? Are you aware that these were ever investigated and any corrective action was put in place?
I'm not allowed to know what's going on. They have moved me away from all of this. The only reason that I have access to these complaints and that I'm allowed to take complaints during this time is because it just got too busy and I begged to help. And I do have a pretty good supervisor, and she saw that I was needed, so she allowed me to do that.
All right, so regardless of whether an investigation has happened or did happen with the prior complaint, this is obviously something the Department of H has a responsibility to look into and stop if they can, right?
Yeah, let's hope.
So again, you know, this is why accountability, this is why we need to know, you know, the public needs to know. People whose parents or relatives are in these facilities need to know if anything being done about this. All right, let's go to our next complaint. And this one is from mid-May, right? Not too long ago, many months into the coronavirus crisis, and well after we knew about the high rate of deaths at our senior care facilities, well after protocols should have been established. And this email from a family member indicates that her positive tested COVID-19 mother was then put back into the facility with her non-positive husband.
Yep, the mother has since passed, and the father, last I heard, was in very serious condition
With the coronavirus. Not sure?
He had several issues.
All right. But regardless, how do you put a positive patient back in the same room with someone who doesn't have the virus? I mean,
well,
that can't be DOH protocol. And again,
right.
Where are the controls here?
Exactly. Well, in this particular case, from, if memory serves me correctly, the family members who reported this weren't really too concerned with that because they were husband and wife. However, I've received multiple complaints from multiple complainants, different facilities, that positive patients are roomed with negatively tested patients.
And I've seen some emails, which we don't have up on our screen now, but you're also aware that staff members who tested positive were allowed to go back and work, maybe with a mask on, but still they were allowed to go back into these very sensitive facilities. Do you have, again, proof, evidence, or is that just a theory of yours?
Proof and evidence, yeah. Yep.
You can prove that staff members with the COVID virus tested positive were allowed to go back in and work while they were still symptomatic.
Well, these are what the complaints are stating.
Okay, got it. Again, so obviously, like we said earlier, just because it's a complaint doesn't make it true, but a complaint of this magnitude certainly means that it should be investigated.
Right,
Now,
and take into consideration, what motivation would somebody have to file a false complaint, especially when it's going to put their job at risk?
Now let's go back and go back to our initial premise. So is it true, and I don't want to put words in your mouth, but again, this is a question that arises. Is it true that because of the great backlog from years ago, that maybe these cases, which are clearly urgent right now during this crisis, that maybe they're getting pushed to the back of the line and aren't receiving proper urgent attention?
Well, last I spoke to someone with firsthand knowledge, they stated that they were not investigating for a while when this virus hit. Now I believe what they're doing, well, in the not so distant past, they were investigating over the phone, which I understand that there are certain precautions that they have to take, but how much investigation can you perform over a phone call? I was told by this person that they were just piling up. And of course, you know, I have to take this person's word for it. And I do have audio of it. But again, what motivation would someone have to give that sort of information when it could put the job at risk?
All right, let's, Larry, who's behind the scenes producing, but let's skip the next slide and jump ahead. We'll come back to slide 6. Let's go to slide 7 because I want to follow up exactly on what you said there, that because these facilities have been locked down, not only can investigators not go there to see for themselves, but family members are being, you know, who have concerns after maybe talking on the phone to their parent, have concerns, maybe their parents complaining about a bed sore, or, you know, not getting enough water, or not getting enough food, or any other problem. They can't go there either to see for themselves what's going on. So this lockdown has really taken away any transparency at these homes outside of the staff and those inside the homes. And it, if they chose to, it would make it very easy for staff to hide evidence of neglect from family members or even from investigators. Is that right?
Right. This is sad.
I mean, in this case, a child asking about the elderly mother. I want to see the pictures of the bed sores my mom claims she has, and she was denied.
Yep, that's what they claim. Yep.
And then she says, and my mom is going downhill since I've been locked out.
Yeah.
Again, not the fault of DOH, but this is the type of thing that must be investigated. And I'm sure you've seen complaints like this over the years, you know, obviously not in the COVID crisis, but over the years where similarly urgent situations were not investigated.
Right.
Wow.
Yeah.
All right, let's go back the slide. And this is, I think, to me, the most heartbreaking, and it's even hard to talk about. I don't even know that I want to show our residents, but we have to. I mean, our viewers. This next slide. So this slide, again, it's a complaint.
Oh, yeah.
So again, we qualify it. It doesn't necessarily mean it happened this way, but it does mean this needs to be looked into. So a resident with the coronavirus is transported to a hospital, according to the child of this resident. I don't even know if it's a he or a she. He was not in an end of life, which means he was not imminent to die. You know, there would be reason to believe he could recover or be treated for this. But when he got to the hospital, he was denied treatment. He was taken off his antibiotics. He was denied further treatment. And instead, he was just given morphine, which, on the one hand, eases any pain and suffering, but on the other hand, it hastens death.
Yeah.
I mean, allowing him to die, as you see at the end, according to the complaint.
Right.
This is true. This is unthinkable. I mean, how does this make you feel, Lisa, when you think about somebody like this?
I remember getting this complaint. The patient was severely dehydrated, by the way.
So that would have been a condition that happened at the nursing home.
Absolutely.
Got to the hospital, dehydrated with COVID. Go ahead.
Yeah, I wish Dr. Scott and Governor Raimondo could be on the phone with these people when they're calling. If that doesn't scare them into doing something, I don't know what will. This just broke my heart because they're just, you have to question why they decided to do what they did, both at the nursing home and the hospital. And it's
So
very scary. It makes you really question why.
horrible.
Is it a matter of the money that they're getting for each COVID patient? I don't know.
Well, these are what investigators need to find out. So, and it's, I mean, this is unthinkable. Let me ask you this. So again, the Department of Health is not responsible for the direct care that a hospital staff member may or may not give to a patient. But is there still responsibility with the Department of Health when one of its residents in one of its senior care or nursing home facilities is sent to a hospital? At that point, is that patient still, quote, under the Department of Health's purview or not anymore?
No, they are. We regulate hospitals. And if, you know, the saying, if the cat's away, the mice will play. If there's little to no oversight for years, and you can't tell me that these facilities didn't know. There were investigators who were so frustrated they couldn't find certain reports in the backlog that they would actually call the facility. The facility's like, what, you don't have it? You know, when you're left to do certain things in order to try to investigate because management made decisions, and some very questionable decisions, outright breaking the law, you know, you're going to have these facilities do what they want. They're, you know, they have been operating with little to no oversight.
Right, and it's like the analogy I said in my open. If the Department of Health should be the police, they should crack down. They should make example of bad behavior or criminal behavior or unethical behavior or inhumane behavior, to set an example so that people don't in the future. But if they don't set that example and they don't crack down, it's just going to just continue. And I think that's what you're saying here. I think that's the whole premise of this interview, is that this pattern of ignoring serious infractions has gone on for so long that when this COVID-19 crisis hit, the system was absolutely unprepared to deal with its consequences. Is that a fair statement?
Yes, it is. I'm going to state for the record that the investigators are really good people. They try to do their job. It was decisions made by management, and that includes Dr. Scott. That includes Dr. Scott. And when I see her on television saying thoughts and prayers go out to all of those that we've lost, it makes me angry, because she knows that this has been going on. She has been aware. Governor Raimondo is aware that there's a mess, and they stand there.
What do you mean the governor is aware?
Well, Seema Dixit told me.
Who's Seema Dixit?
She was the chief of facility regulations, who, by the way, is a very good friend of Dr. Scott's, who, by the way, got a huge promotion after creating one of the biggest messes in facility regulation. How does that happen? She told me that she was.
And you're comfortable this has been raised up to the governor? Do you know that, or are you theorizing that?
I have audio of Seema Dixit telling me that she's meeting with the governor weekly.
You have audio?
Yes, I do.
And do you know that these specific issues in general, this backlog and all that, is what was discussed? I mean, do you know what transpired in that meeting?
I don't know what exactly transpired in their meetings. I would assume that if they're meeting weekly with the governor, then the governor's aware that something's going on, because that just doesn't happen normally.
And are you aware that Director Scott, Alexander Scott, or Governor Raimondo have taken any steps to correct this?
They've tried in certain ways. I've even offered solutions and they ignored it. I'm the one who's been doing it the longest. I was trained by good people, and you know, I maybe because it was my idea, I don't know. They just don't.
All right, we'll kind of come back to some of this in a second, but I want to finish one more comment or thought on that last one of the previous slides we saw. You even, and I don't know if you have proof of this, but you have theorized to me, because we also know in this state that of those seniors, the twice the rate in our state of deaths compared to the general population in Rhode Island among nursing homes and other congregate care facilities, that among those deaths, an unusually high number, I think the number was 60%, never were transported to the hospital and just died in their nursing homes.
Yeah.
You theorized to me that they were purposely not sent to the hospital because of the neglect that we talked about, bed sores, dehydration, malnutrition, that nursing home staff was concerned that if they sent one of these neglected patients to the hospital, that neglect might be discovered and reported by hospital staff. That is a stunning allegation, and if true, as sad as I can imagine.
Mm-hmm.
What do you say about that? What do you have to back that up?
Okay. Based on complaints that I've received in the past, that from staff members at specific nursing homes, that they are frowned upon when they want to transport a resident to the hospital. They want to avoid that. And my fear is that it may be happening now.
And you think it's because they're concerned about being discovered, their neglect being discovered?
Oh, yeah. Yeah.
Can you prove that, or is that just a theory?
I can prove certain things from the past.
Past practices that may be repeating today.
Right.
Wow. We just looked at 6 complaints. How many do you think you fielded over the years, and how many pieces of evidence like that do you have in your possession right now?
I've seen thousands.
And how many do you have in your files right now?
Oh, I have plenty.
Hundreds, would you say?
Yeah.
You also have audio files, and you had mentioned it earlier, where certain complaint cases had their dates falsified so it wouldn't look like they were so old and left there, or even were closed by Department of Health officials without an investigation, again, to make it look like their backlog wasn't as large as it was.
Exactly.
To hide their record of incompetence. Again, is this theory, evidence, or something you can prove?
Evidence and proof. Yep.
What kinds of evidence do you have?
I have audio. I have email. I have video.
With Department of Health officials who verbally corroborated this?
Yes.
Again, this needs to be investigated.
Oh, yes.
You also claim that a lot of this, that these concerns or complaints don't want to be fully vetted and exposed. And by the way, if a case is vetted, is there any public reporting requirement here? Or even if they did investigate these, could they keep it quiet?
That's what started this whole thing, the Eleanor Slater sexual assault.
Sexual abuse cases really what got your alarm red flags up.
Yep.
And they tried to keep that investigation quiet, is what you're saying.
Yeah.
So again, it's a pattern.
Yeah. They tampered with my original report, and then they put in another report under my name, and I didn't write it.
So that's, again, something that, you know, we're not going to go into here, but that's a story in and of itself that needs to be looked at, that never was properly investigated or closed. All right. Now, you also have a hunch. You can tell me if you think it's more than a hunch, that the reason they don't want a lot of these cases exposed and investigated, because it might hurt their quote accreditation. The department, as I understand, a national third party gives accreditation to each state Department of Health, and if they get that accreditation, they're then eligible to receive, I'm sure, many, many millions of dollars in federal aid and support.
Mm-hmm.
And so, again, I'm going to ask you directly, do you believe that a lot of this is motivated to hide the problems going on, to hide the incompetence in studying these backlogs, just to ensure they get that accreditation and get those federal dollars?
Yes, that's what I believe. It is disgusting. I can't imagine anybody being like that, but they did receive accreditation in 2015, and they are renewing this accreditation this year. And, you know,
This year they're up for accreditation, the Rhode Island Department of Health?
right, do the math, okay? They change triage dates. They decide to close out cases.
Which you can prove, the changing of the triage dates.
Mm-hmm. Yes, absolutely.
Absolutely.
Absolutely. Several ways.
Okay. Wow.
Yep.
All right. So just this past week, members of the Rhode Island General Assembly called for the House Oversight Committee to convene, even though the General Assembly refuses to convene during this crisis. But at least they're calling for that committee to convene to look into what everybody now in this state now knows is this high rate of deaths in our nursing homes, as you know, because of this coronavirus pandemic.
Mm-hmm.
You've just given a lot of answers why, right? Why this may have been happening.
Mm-hmm.
Do you think it's a good idea for House oversight to provide some investigation here about the lack of oversight that the Department of Health apparently has ignored over its facilities? Do you think it's a good idea?
I think it's a must. I think it's a must. And if they don't, they need to check their gut and why they're sitting where they're sitting. And I'm sorry to be that harsh, because there are good men and women. But I'll tell you, the people of Rhode Island need to know what's going on. And the people who they have elected need to protect their citizens, even if they're in a state where they can't vote. These are
the most vulnerable of our citizens.
Yeah. It's
if that committee convenes soon or in the future, would you be willing to testify and lay out
begging them?
Begging them.
I've reached out several times, and there are very good people who are in support.
But nobody yet has taken any action. So let me ask you about that, because I mentioned that in my opening remarks. You, over the years and recently, you have contacted people in the media.
Yes.
You've contacted lawmakers.
Absolutely. Trying
to raise awareness about this and raise some alarm bells. And while you say there are good people, none of those good people, and even if none of those good people did anything to help you raise awareness, isn't that correct?
Absolutely. It's frustrating. Very frustrating.
Why do you think? And this is pure speculation, I get that, but why do you think?
One in particular that I was talking to, very nice person. I want to believe that their hands are tied because of the publication that they work for. I don't know, because given the situation now, you would think that this would be very important to come out. It's unfortunate that it took almost 5 years for me to be sitting down with you, and I'm very thankful for that. Could I have kept quiet and taken my lawsuit and gone? Yeah, but what kind of person am I if I do that?
Well, why would a lawmaker not want to raise alarm bells and have oversight look into this? What would be that motivation?
I can only give you my opinion. You know, they're a low man on the totem pole. They don't have the support of their colleagues. Fear, which is, I can understand. There are a lot of people, even in my office, who are fearful to come
You
forward.
have fear. You told me you have fear.
Absolutely, but what am I going to?
But yet you're coming forward.
Well, what kind of person would I be if I didn't? You know, you have to. I know that this is not going to help my career. I know that. But if that were my mom and dad, oh, let me tell you, heads would roll. Heads would roll. And there's some really good people that I talk to. My heart goes out to these people. You know, I'm not a perfect person, but, you know, I have a heart. And and from what I know, this is insane.
So,
And I watch these daily briefings, and they look right into the camera, and it's insane.
So let me bring one of those. You know, we're taping this on a Saturday morning, and just yesterday I heard Director Alexander Scott publicly say at that briefing that during this crisis, the Rhode Island Department of Health is doing everything they can to ensure the safety of seniors in our nursing homes and assisted living facilities because lives matter.
Yeah.
Do you feel that the Rhode Island Department of Health has done everything it can to protect seniors' lives?
No.
For all the reasons we've talked about today.
There are good people in that building, but they have to answer to that one person. I had so much faith when she came into her position. I wanted to, but she has failed me, and she has failed the people she's paid to protect. I just said it.
Well, it would certainly be one of the largest and most grotesque failures of government we have ever seen, as I also mentioned in my open. One last topic with you, Lisa. Are you okay?
Yeah, I'm mad, but whatever, this happens.
Now, this one is pure speculation, but it rings true to me. I did a detailed data analysis recently that would support what I'm about to say. Now, you've also discussed with me that's your belief, and again, your belief, I don't think anybody could prove what we're about to say here, that state officials, including the governor, are taking advantage of these senior care numbers, this pandemic data, again, which is largely focused in a nursing home community, as tragic and atrocious as it is, to justify lockdowns and current harsh reopening regulations across the whole state.
Yeah, holding the state hostage. Yep.
Because of a situation that you believe largely exists and didn't need to exist in our nursing home facilities.
Yeah.
Now, that's just a gut feel. Obviously, there's no way we could know that, right? I mean, again, we have to, this is a serious accusation, but I can tell you it's what a lot of people believe.
Well, I've also just met someone who has documentation from CDC where it explains how much money that nursing homes and the state will get for COVID-19 positive patients, whether different prices. If they're ventilated, they get more money. This is just,
again, more that needs to be investigated. How much, it's impossible or unthinkable to think that money could be driving some of this negligence. But for whatever reason, the investigations have not happened over the years. It has led to a bigger disaster in our nursing homes, according to you, during this pandemic than it ever had to. But the past record was so poor. Lisa, I want to thank you for being my guest on In the Dugout, for your courage and your compassion in trying to raise alarm bells about this very serious issue. Do you have a final word for us?
Thank you so much for taking the chance by speaking with me. Um, I want to apologize to the people of Rhode Island. I've done everything I possibly could to try to fix this problem. Um, I promise that I will continue to try to help, even though I probably, I don't know where this is going to go after this, but I had to do it. I want to know, I want Governor Raimondo and Dr. Scott to do some serious soul searching. Um, and
Well, Lisa Camuso, you are a true patriot, a true public servant. I thank you for your service. I thank you for your care. I thank you for your time. And we don't know what the next few days or weeks will look like once this gets exposed. We hope it will lead to investigation. But Lisa, thank you so much for being with us.
thank you too. I really appreciate this. You've been a lot of help. Thank you.
Thank you, Lisa. So let me just wrap up. My opening remarks probably sounded like I was sensationalizing the situation, but I don't think I was. This is sensational stuff. I asked Lisa repeated times, does she have evidence? Does she have proof? Or is it just a theory? But you know what? Really doesn't matter, because whatever the case, when a longtime public servant in the know, and again, she is the state's foremost expert in fielding these and with the most experience in fielding these complaints about senior citizen care. When someone like Lisa raises alarm bells on matters this sensitive, this important, this deadly, comprehensive and thorough investigations must occur. It is my hope that this interview with Lisa will be a catalyst for such investigations, that they begin in earnest and determine whether how much truth there is to what Lisa is saying. This should happen in the media. This should happen in government, General Assembly oversight committees, and this should happen in earnest in the Department of Health itself. We're in the dugout. This is Mike Stenhouse wishing all of you Godspeed during this pandemic.